Namaste, Shri Gurubhyo Namaha. I'm Dr. David Frawley, joining you from the United States, actually the mountains here. And it is my great honor to be with you for this first International Ayurveda Conference and Arogya Expo, organized by the Ayurveda Medical Development and Research Foundation of Nepal. Now, of course, Nepal has a very long history as a center for Ayurveda and Vedic knowledge overall, and as a place where some of the best and most prime Ayurvedic herbs grow, and the Ayurvedic products are developed, and part of the society and the culture overall, and part of this great renaissance of Ayurveda that we are seeing globally. I've been involved in this Ayurvedic field for over 40 years. I've helped with the spreading of Ayurvedic teachings in many countries throughout Europe, Russia, North and South America, to parts of India, Indonesia, and even the Middle East to some extent. So Ayurveda is undergoing a great expansion, and its role in world healing is coming forth in a very strong way. And of course, its role in the Indian subcontinent and its ability to do several important things. One is to promote natural healing at all levels. In Ayurveda, every aspect of nature, every circumstance, environment, plant, energy has a potential healing power, although it can also cause disease if used improperly. And also, Ayurveda is very important today because we are so far removed from nature in our daily lifestyles, particularly in the Western world, for example, here in the United States, but also in the urban aspect of India and even Nepal, in which people today are now living in very large cities like Delhi or Mumbai or even Kathmandu, in which our lifestyle becomes progressively artificial. And our modern medicine is also becoming progressively artificial in that it is using more of the chemical and the drug-based medicine rather than addressing the causes of diseases in wrong behavior, wrong diet, lack of exercise, and overall in a life out of harmony with our individual nature and with the world of nature as a whole. So globally, even with the great expansion of modern medicine and all the benefits it has, which are many, particularly relative to surgery and pain relief, that our health problems are continuing. For example, in the United States, it has now been shown that the longevity of men has dropped almost 5 years in the last 10 years of studies. So there is a health crisis. The second issue we have to address in this regard is all the challenges and stress of our new technology, our informational technology, the computers, the cell phones, and all these related problems that go with them, because all of these machines overstimulate our nervous system. They are like a drug. Sometimes I say that the digital drug is becoming the drug of choice for us today. So what is going on is that our nervous system being overstimulated is disconnecting us also from the forces of our nature, from our own prana, from our own minds and senses, and we are getting more emotionally and mentally prone towards disturbance. And this is happening also more so relative to the young people as the younger generation grows up living with and being taught by or entertained by a cell phone, which is essentially a little box and screen. So we have the benefits of artificial intelligence, but we also have the dangers of artificial intelligence. So how do we compensate for the negative side of our new technology and learn to benefit from the positive side? And that is where Ayurveda and yoga come in. And that is where the psychological aspect of Ayurveda comes in, something that I have addressed in one of my books, specifically Ayurveda and the Mind. Now, in Ayurvedic treatment overall, we have two prime levels of treatment. First is the Yukti Vyapashraya, the so-called rational therapy, in which our main goal is to reduce the excess doshas of Vata, Pitta, and Kapha, and then bring more health and longevity through cultivation of Ojas for improvement of Agni, and for right diet, right herbs, right exercise, ultimately Panchakarma and Rasayana, or rejuvenation overall. This is mainly a physical therapy, but it does have psychological implications. And then we have at a second level the Sattva Vijaya treatment, which is the yoga therapy, comes in also for increasing Sattva guna and for reducing the gunas of Rajas and Tamas, which are the main factors of disease at a psychological level. And our society today, there's a lot of Rajas with this overstimulation that we have, and there is a lot of Tamas with the inertia, darkness, and disturbance that is going on around us and our artificial way of life. So Ayurveda has here, with this Sattva Vijaya, not only the use of yoga, but also certain Medhya, Rasayana herbs for improving the nervous system. In Ayurveda, we have two causes of disease. First main is prajna parada, which is wrong judgment, wrong perception, wrong values, an inability to discern the difference between what is true and false, dharmic and adharmic, what promotes health versus what promotes disease, and making wrong choices and decisions in life, wrong diet, wrong behavior, wrong interactions with our environment, and lack of proper care of our own self and well-being. And second, the wrong use of the senses, which is usually an excess use or inappropriate use, and that is also very much highlighted in our society today when we are overstimulated. Now, in the West, we're having an epidemic of depression, anxiety, and depression going on, and a massive use of pharmaceutical drugs to deal with that, even though it is a behavioral issue overall. And the result is this anxiety and depression problem is increasing. It is not slowing down. It is not getting better. The treatments are not becoming effective. In fact, the drugs to treat this are also becoming addictive. Now, this is where Ayurveda can help us in a primary way. What causes depression is excess stimulation, and we're having too much of that through the senses. So over time, we get tired of that. We go beyond the threshold, and then it ceases to affect us. So here, Ayurvedic massage is very important. Ayurvedic massage oils, Chandanadi to the head, Balashwagandha, there are so many, and even aromatherapy, even sandalwood oil, and then even certain herbs. I mean, if you're looking at a computer all day long, you should also be taking some tulsi tea to clear the sinuses, or even some Brahmi tea to bring more calm and collectedness and coolness to the mind. Or as we get older, we would also need to use herbs like ashwagandha to fortify ojas, not only at a physical level, but also at a psychological level, and change our behavior, our right patterns of eating and sleeping. Unless we have proper deep sleep or sushupti, then we will not have proper calm or peace. Right timing of getting up in the morning, going to sleep at night, and a better use of the senses. I always tell people, I know it's very difficult to do. One of the problems we have is we're losing our depth perception because we're looking at little screens all the time. So it's very important we regain our depth perception, looking at the sky, the clouds, the horizon, the stars, the moon. I know that's not easy in an urban environment, but it is very important for us to consider and also for us to do long term. So Ayurveda has many tools for the mind, and this can also then link with yoga, with pranayama, pratyahara, dharana, mantra, and meditation. Mind and prana work together, so we need to calm and unify both together. Otherwise, the disturbed prana disturbs the mind, the disturbed senses disturb the prana also, and well-being becomes very difficult to accomplish and to achieve. Now, this, of course, is a unity of yoga and Ayurveda, and that is something that we also need to emphasize, and even the importance of regular meditation as an integral part of an Ayurvedic lifestyle is also there to be considered. So there's a great history here. There are many remedies. There are many forms of diagnosis for dealing with the mind in yoga and Ayurveda, from physical and dietary to the highest meditative levels. And we need to learn how to apply these and share these, and how to remove these excess dualistic emotions, fear, anger, attachment, their doshic connections, and bring Ayurveda its full scope for addressing the whole of body, mind, and consciousness. This is an important focus for all humanity. It's very important in the West. It's also very helpful everywhere in the world. And I am happy to bring this focus into our discussion here. And I am glad that the Ayurveda in Nepal is also willing to address this, because it is very important, but it is an integral part of Ayurvedic as a whole. And we need to bring all of Ayurveda together, whether physical, psychological diseases, or just simply right living, right behavior, dharmic living overall. And if we do this, then Ayurveda can really help improve not only treatment of disease, but also making us feel better, wellness, calm, happiness, strong, physical and psychological immunity, and also better contentment and happiness overall. So it is my wish and my prayer that the Ayurveda in Nepal expands and brings out the Nepalese heritage, which is also connected to yoga and Ayurveda, and share this with the entire world. And I know this will occur, and it will make a difference for the health and well-being, not only of Nepal, but for all the countries connected to Nepal, and to the Ayurveda of Nepal, and to the great prana, and the great beauty, and the great meditative power of the Himalayas here. So with these words, I will close my talk. Shri Gurubhyo Namaha, Hari Om Tat Sat. May all the pranic power of Ayurveda be with all of you.